So what opportunities do liver cancer clinical trials offer patients? We've talked about all these advances in terms of therapies that are on market, but obviously a lot of research also going on in terms of hopefully finding even something better in the future. So tell us how you incorporate these liver cancer clinical trials in your practice and how patients should be thinking about them.
So, Amit, while we spoke about all the good things that we're going to offer, we have to really be thoughtful of two important things. One of them, what if the liver function does not permit therapy anymore? What if the disease is so spread out and there's no clinical trial, there's no other availability? We have to make sure that comfort and dignity are very critical for our patients. And for that reason, palliative care will be an important part to think of in case necessary for that. Don't beat the odds. Let's make sure that we kind of preserve comfort and dignity. Nonetheless, there's opportunity in regard to clinical trials because this is how all the therapy that we just spoke about today, they're all actually started as clinical trials. So please, we always encourage patients, if it's accessible, if there's need for it, by all means to join in on a clinical trial. Don't go out of your way for that. If you're comfortable only, don't ever push yourself or have a family push you one way or the other. Only if you're comfortable and it's available and it's accessible to you, by all means, it can happen that it can be valuable. What are the concepts that we're bringing in clinical trials? Remember, we already, in the old days, looked into biologic therapy. We looked into immunotherapy. We looked into combination of immunotherapy. Now we're talking about the enhancer of immunotherapy. Can we enhance further the immunotherapy? Can we look into cell therapy? Make sure that cancer are not only be seen, but rather smelled by the immune system. So there's a lot going on, but more importantly, if it is available, it's a need and you need it. And number three is you're comfortable with the plan of a clinical trial. By all means, we strongly encourage you to always join a clinical trial if you can.
Yeah, no, I completely agree. I think clinical trials, do offer access to some of the newest agents coming to market. And we've seen a lot of promising trials that are now being done. And so if one is interested and one has access, I think it's always nice to consider these clinical trials across the different stages.